Hello and welcome to today's video on endometriosis. Now, this is a condition that affects millions of women worldwide, and it's a leading cause of pain, discomfort, and even infertility. Today we're going to explore what endometriosis is, its symptoms, its causes, and the various treatment options available, including both conventional and herbal approaches. First and foremost though, what is endometriosis? So endometriosis is a condition where the endometrial cells, which normally line the uterus, are found outside the uterus in places like the ovaries, the fallopian tubes, the bladder, or the intestines. These misplaced cells respond to hormones, especially estrogen, just like the lining inside the uterus. During menstruation, they break down and bleed, but unlike uterine bleeding, these cells have no way to leave the body, causing inflammation, scarring, and pain. Endometriosis usually starts between the ages of about 12 and 13, and it's a major cause for dysmenorrhea, otherwise known as painful periods. It can cause painful intercourse and infertility. Now, whilst the pain can be cyclic and worsen over time, symptoms often improve during pregnancy whenever progesterone is dominant in the system, and they usually resolve after menopause. Now, the symptoms of endometriosis are very various, depending on the location of the tissue. So some common symptoms include pelvic pain and bloating, painful intercourse, diarrhea, nausea or vomiting, blood in the urine or pain during urination if the bladder is involved, pain during bowel movements. There can be constipation or rectal bleeding during menstruation if the intestines are affected. And then there's an ovary-based endometrioma, which can rupture, causing acute pain and even shock. Now, symptoms tend to lessen during pregnancy and can dissolve after menopause, but clearly you don't want to wait for those to be able to find relief. So there is some stuff that can be done to test and to diagnose. So diagnosing endometriosis usually requires a laparoscopy, which allows doctors to view and biopsy the tissue, and it's often considered if non-steroidal anti-inflammatory drugs or oral contraceptives don't alleviate the pain. So they'll always treat first before they do the laparoscopy. However, non-steroidal anti-inflammatories are not very effective in many cases, and they can cause gastrointestinal tract disturbances and other side effects, such as cardiovascular issues. So better to get on top of this than to go on anti-inflammatories for a long period of time. The conventional treatments for endometriosis often involve hormonal therapies aimed at reducing estrogen levels, such as GNRH analogues and oral androgens. IUDs, intrauterine devices that release hormones, are useful, but they can stop natural progesterone production. And aromatase inhibitors like letrozole and anastrozole, which reduce estrogen production, can sometimes be used. Now, in more severe cases, surgical options like laparoscopy, pelvic ablation, or hysterectomies may be recommended, but recurrence rates are high even after surgery. So the causes for endometriosis, well, there's several theories out there, but none of this is conclusive. There's coelomic metaplasia, where hormone and immune factors transform normal cells into endometrium-like tissue. There's an idea called retrograde menstruation, where the menstrual blood flows backwards into the pelvis, carrying endometrial cells, where they are planted and then cause endometriosis. And then there is the idea that even lymphatic or vascular tissues can help spread endometrial cells. What we do know is that endometriosis is also linked to inflammation and to immune system dysfunction, with higher levels of inflammatory cytokines and immune cells found in the pelvic area. So the risk factors for endometriosis is somebody who's gone through menstruation very early or puberty very early, with long menstrual cycles and heavy bleeding. If they have had intrauterine devices, strenuous exercise during menstruation, or experience an autoimmune disease, then it's quite possible that they can develop endometriosis. If they have a high use of coffee or alcohol, or a diet high in red meat, then endometriosis should be considered. Hormonal involvement. Well, estrogen plays a key role in endometriosis by contributing to cell survival, inflammation, and adhesion of misplaced cells. Women with endometriosis often show progesterone resistance, meaning that their bodies are less responsive to that hormone, which can worsen the condition. And additionally, we have microplastics in our water and in our food. And these xenoestrogen plastics have chemicals that dominate in your system and further potentiate the amount of estrogen that you have in your body, and certainly plays a role in endometriosis. So let's talk about herbal treatments for endo. The aim of the herbal management is to improve circulation in and around the pelvis, to reduce pain, reduce bleeding, and reduce the amount of inflammation. We want to support the immune system, modulate your hormones, and improve fertility if it's needed. Some effective herbs include Vitex agnus castus. This is chasteberry and black cohosh to help modulate hormones. We might use anti-inflammatories such as turmeric, frankincense, and ginger. We would think of calendula and centella asiatica. This is gotu-kola for reducing scarring. And then cramp bark, corydalis, and ginger are all helpful to manage pain. Now, to reduce estrogen dominance is really useful, and flaxseed is particularly effective here. So to reduce estrogen dominance, flaxseed is particularly effective. And additionally, milk thistle, chelidonium, and dandelion are helpful at supporting the liver processing excess hormones and getting rid of dominant estrogen picture. Diet is also a huge role in managing endometriosis. So a diet rich in soluble fiber, such as oats, legumes, vegetables, fruits, and seeds, help reduce estrogen levels and improve bowel health. Fermented foods and probiotics, particularly bifidobacteria, can support gut health and reduce the amount of inflammation. You want to include herbs such as flaxseed, dark berries, cruciferous vegetables, and green tea to lower inflammation. And avoid red meat, processed food, and caffeine, which can worsen symptoms. Now, moving on to supplements. Several supplements have been shown to be helpful in managing endometriosis. These include vitamin D, which regulates the immune system, vitamin B6, E, magnesium, and zinc, omega-3 fatty acids to reduce inflammation, and NAC, which helps reduce cell proliferation and pain without the side effects. Pycnogenol and grapeseed extract are also helpful as anti-inflammatories and reducing adhesions within the system. Now, there are a few herbal remedies that may be of use, and I will put them in the handout for sake of ease of use. But there's a flooding mix that is suggested by Aviva Rom for heavy bleeding, and that includes lady's mantle, yarrow, cinnamon, and cramp bark to reduce excessive bleeding. Bitters are used to help with digestion and hormone clearance. And a digestive mix can be really helpful on the run-up to menstruation whenever you're more likely to get constipated, with herbs such as rhamnus, chamomile, milk thistle, and chasteberry to help support the liver function and digestion. In summary, endometriosis is complex and often painful, and it is better to go and get a treatment plan specific to you and where the endometrial tissues are actually sitting. But there are many ways to manage this effectively. So whether it's through herbal treatments, dietary changes, or supplements, the goal is to reduce pain, support your hormones, and improve overall quality of life. If you have any questions, if you want to get in contact with me at the clinic, it's thewildsage@proton.me, and that's an encrypted email that only I get access to. Thank you for watching. If you find this video helpful, please like and subscribe. Share it with anybody else who might benefit. And I'll see you the next time.